Like eating, drinking, and breathing, we need sleep to survive. And for many Americans, sleep medications do not work. That's why there's a growing trend of turning to a cognitive behavior therapist to end insomnia. Joining us now is psychologist and podcaster, Dr. Dan Baughn. It's great to see you, Dr. Baughn.
You as well, Gail. Thank you again for having me back.
Absolutely.
I'm excited to be here.
Well, sleep is something that is so fleeting for so many of us, and people struggle with insomnia. And quite frankly, sleep medications don't always work. I mean, they might aid some people, but they're a Band-Aid for the next guy. And so it's about learning it from a cognitive behavioral standpoint, which is a growing trend. Tell us about what you do.
Absolutely, yes. So yes, great question. So the challenge with insomnia is for a lot of people is that it really depends on how long they've been living with it, right? So if it's been less than about 30 days or so, that could be like something acute, something that you could use a medication for. But if it's roughly at about the 30 days to 3 months and then really beyond 3 months, that's really when the sleep medications aren't really going to be that helpful at all, because those medications really are just treating the symptom, but not what's really causing you to get really bad sleep in the first place.
Well, I know it's different for each person, but what are some of the common thread causes of sleep issues?
Great question. And I would say the most common cause is typically a significant life event of some kind. It could be a work stress, it could be a personal life stress, it could be, for a lot of my clients, it's a physical health problem that kind of shows up. Some of it's just unpredictable, and then that like throws a wrench in your regular sleep routine. And then that kind of sends this shockwave effect through the rest of your sleep. And unfortunately, it's how we handle poor sleep that causes insomnia to really stick around for a lot of people.
Well, I think, because I went through a long bout with insomnia, and I think a lot of it was just trying to adjust my schedule from waking up at 1:30 in the morning to go to work to like living that of a normal human.
Absolutely.
and
shift work is rough.
Shift work is rough. And it was, but what happened to me on a psychological level is I was so panicked about not sleeping and not arriving for my, gone were the days of being able to come home after work, take a quick nap before I pick up the kids. Like my schedule was all thrown a loop, and so the rat in the wheel in my brain was making matters only worse, and the insomnia just kept getting. It was like a downward spiral.
You got it, absolutely. And you kind of characterize exactly what it is for a lot of people, of where the problem starts and it's like dominoes, like one thing kind of leads to the next, to the next, to the next. And one of the things that we do know with sleep difficulties around insomnia in particular is that you could have a difficulty with trying to fall asleep, which is a good number of people. You could also have a difficulty with waking up in the middle of the night and not being able to get back to sleep. And then there's a smaller group of people where they have difficulty of waking up too early. So maybe you wake up at 3 a.m. and you're wide awake and you can't go back to sleep at all. So really there's different strategies for approaching each one of these particular types of sleep difficulties.
So what exactly is cognitive behavioral therapy?
Excellent question. So cognitive behavioral therapy, and it's for insomnia, is a big difference there. So when you're looking for it, you're specifically looking for something called CBT-I, which really what it is, it's a blend of a couple different kind of treatment approaches that really are trying to help you do a few things. Number one, look at your actions or your behaviors. That's the B in the cognitive behavioral part. And then you're also taking a look at maybe your mind, and that's the cognitive piece of really, for a lot of us, anxiety and sleep problems go hand in hand. Or really, I would say it's not even necessarily anxiety, it's just being really activated, or really your brain just doesn't want to turn off at the end of the day. And so you're using a couple different pieces to help that really calm down.
And so you're giving people skills to know how to react when that happens. So like, you might wake up in the middle of the night and then just tossing and turning and huffing and puffing in your bed might be the exact opposite of what you should be doing.
100%, yes. So yeah, in fact, so a big part of this is where I might kind of geek out a little bit on the sleep stuff, is that, what's interesting is a lot of times what our brain is doing and how our brain is learning to associate things with sleep does a lot of this stuff outside of our awareness. And unfortunately, that shows up when it comes to sleep. So what we really want to do is learn to stop connecting bad sleep with being awake in the middle of the night and being in our beds. And so a big part of what we do is saying, okay, if you woke up in the middle of the night, once you get up, get out of bed, get out of your bedroom, you can go to another area in your home, it could be a living room or a kitchen, and just do some other things that are not too activating or too arousing. So try and keep the lights lower, try not to, turn on your devices if you can. And you can do things that are what I call my tired but not sleepy activities, which are things like a coloring book or folding laundry, or it could be, thinking out about what needs to happen for you the next day. And usually you're just trying to do an activity to where your brain is like, okay, I'm there, but there's no need for me to continue to stay awake. And then what you're learning is to then go back to bed once you are feeling sleepy again.
Well, I just want you to know that from the last time you were here and you told me if I wake up in the middle of the night to pick something with the letter like in my pantry, like a B, like bolognese, bread, and keep going down the list. The next thing you know, I was right back to sleep again.
Yep, absolutely. Cognitive shuffling is great.
I love it. That was a good tip. All right, we can't wait to have you back on Bloom. Thank you so much, Doctor.
You're welcome. Thanks so much.
All right, to share this story with your friends, head to our website, WFLA.com/Bloom.